In this video, we'll talk about breast pathology. So in general, if you have breast discharge, if it's bilateral, it's usually not as concerning. You should probably test the woman for pregnancy or run tests for galactorrhea. If the breast discharge is unilateral, that's definitely more concerning. Now, ground rules for imaging for any sort of breast tissue. If the patient is less than 30 years old, you want to do an ultrasound first, and then you can do a mammogram if necessary. If the patient is greater than 30 years old, then you want to do a mammogram first, and then you can do an ultrasound if needed. This is just because of the way the density of the breast tissue is. Now let's say you find a cyst on ultrasound. If it looks like a complex cyst, then you straight go to biopsy. If it's a simple cyst and if it's asymptomatic, then you can just observe them. If it's a simple cyst but it's tender, then you can do a fine needle aspiration, and if the aspiration is bloody, then again you go to biopsy, or you can do additional imaging. If the cyst is simple and tender or symptomatic, but the aspiration fluid is non-bloody, so it could be like yellow or straw colored, and the cyst resolved, then you can just reassure and you can check back in 4 to 6 weeks later to see if it comes back. If it comes back, then again you need to go do a biopsy, but if it just went away and hasn't come back, then you're good to go. So the first sign of puberty in females is actually breast development, known as thelarchy, and then after 2.5 years is when menarche should occur. If you have a female who's greater than the age of 15 and already has developed sexual characteristics but hasn't had a period yet, or if you have a patient who's greater than the age of 13 and still hasn't even developed secondary sexual characteristics, this is when you become a little concerned and should do a further workup with a pelvic ultrasound and FSH. Whenever you hear or read unilateral bloody nipple discharge, the first thing that should come to mind is intraductal papilloma. Paget's disease of the breast is when you have that itchy eczema, ulcerating rash on the nipple on the breast, and the high yield association with this is always an underlying adenocarcinoma. Inflammatory breast carcinoma is when you have the putate orange appearance and the dimpling of the breast. Fat necrosis of the breast always happens when you have some sort of trauma to the chest area, and on histology you're going to see fat globules and foamy macrophages. There's no need for further workup for this. Fibroadenoma and fibrocystic changes of the breast are both benign conditions, and they both will cause pain before your menses, and it should resolve afterwards. Fibroadenoma will be a single firm, well-circumcised mass, usually in one breast, so it can be concerning for breast cancer, but it's actually benign. And fibrocystic changes are multiple palpable cysts that will be present in both breasts, and again, this is going to fluctuate with menses, so you want to monitor both of these over the course of a few cycles. If you have infiltrating ductal carcinoma of the breast, on histology you're going to see microcalcifications. Invasive ductal carcinoma is actually the most common type of histological presentation of breast cancer. This will present with traction. So breast cancer screening starts at age 50, and you should get a mammogram every 2 years. If you have the BRCA mutation, which is autosomal dominant inherited, you have an increased risk of getting breast cancer. If you have Klinefelters, these people have an extra X chromosome, so that increases their risk of getting breast cancer. If you have a first-degree relative with bilateral breast cancer, you are at a really increased chance of getting it. And also, if you have any relatives with breast and ovarian cancer, that also increases your chance of getting breast cancer. Lobular carcinoma in situ. The in situ part means that the cancer hasn't crossed the basement membrane yet. So right now it's benign, but it has a really high likelihood of turning into malignant and becoming invasive lobular carcinoma or ductal carcinoma. So you should do an excisional biopsy.